Hello again, Dr. Dale Miles, Dr. Conebeam from Fountain Hills, Arizona. I'm on my LinkedIn page to post another video, and this one is actually going to be a follow-up to the initial one I posted on tracking the carotid artery, the internal carotid artery in the sagittal views. I'm going to show you a case today of a minimal calcification in the medial layer, or MAC, medial arterial calcification, in a patient who did not have a diagnosis of diabetes but who had hypertension. Of course, we sent this patient for follow-up. I don't have the results. I've got them back for many patients where the hemoglobin A1C was elevated, and they went on to get a glucose series of tests in order to confirm the presence of type 2 diabetes mellitus. So I'm going to show you one case today of minimal amount, and then in a follow-up video I'm going to show you a patient with calcifications that are a little more straightforward. So I'm going to go to the software. I use On-Demand 3D because of the utility. I can't own everybody's software for every machine, so this allows me to take DICOM data in and look at it. So I've anonymized a patient here that we're going to take a peek at, and we're going to look in the sagittal view again. We'll put it in the dynamic light box, it's a little easier. And you can see this patient has a large palatal torus. We're just about in the midline. You can tell that by scrolling, and you can see the nasopalatine canal coming up to the foramen here. The vertebral bodies, if they look like vertebral bodies, you're pretty well in the center of the slices. And I'm going to put a filter on. I'm going to put a 1x filter to make it a little bit sharper. So we're going to go up to the region of the condyle again, and as I come a little more medially, you'll see that the vessels open up again, the two I told you last time, the internal carotid, the internal jugular vein and the internal carotid. And as we go towards the sella turcica in the midline, you'll watch this pathway of the carotid. So coming along here, you can see it going up. And then lo and behold, as we get up to this region, you can see a couple of calcifications, and they look like they could be in the wall of the artery. So I'm going to mark them. We'll do it with just a yellow arrow. I'll do it with a nice blue arrow today. So we've got these calcifications that look kind of linear and parallel. Excuse me. And if I pick a free draw and go to a different color so that you can see, this is the artery coming up. I'm going to put it outside the calcifications, but you can see these calcifications are probably in the wall. So as I go a little bit more medial, you can see a little bit more of it being defined here. And then as I come a little bit more medial, you can see it again here. Now I'm going to go to the other side. This is coming to the right-hand side, and you can see that there's some similar patterns here and here. Let's get the arrow again. I'll make it green on this side. And so you can see the carotid artery comes up, and we've got some linear calcifications. Those are calcifications in the medial arterial layer of the carotid artery. This is the cavernous segment. And those calcifications are highly suggestive of someone with diabetes that's uncontrolled, or maybe someone who's got diabetes that doesn't know, or they're undiagnosed. I'm going to overlay a picture of a diagram of the carotid artery as viewed from the side with this particular picture so that you can see what it looks like. In this particular view, I've brought up the segment I was working on, and I'm going to just reduce this and bring up a PowerPoint that I cropped or captured a screenshot of. And if you look at this, you'll see that here is the internal carotid artery. Here is the outline of the arterial wall where the medial arterial calcifications are. The sphenoid sinus is right here. So in this diagram to the right, the sphenoid sinus is here, and the carotid comes up through the cavernous segment past the clinoid process up through the ophthalmic segment. Of course, the pituitary gland sitting here. So in the walls of this artery is where you'll see these linear calcifications in the sagittal views. Let me switch to the coronal section for a second. And what I'll do is I'll straighten this patient up a little bit so that we've got some symmetry. This is the foramen rotundum here and here. This is the sphenoid sinus. We're going to go posteriorly from there, and you can see that the calcifications I've been talking about begin to show. If I go a little bit further, you can see that at least on this side, this calcification is somewhat circular, or curvilinear, if you will. Now you can make it more apparent if you thicken the slice. I usually do somewhere between 5 and 10. On this one, because it's subtle, I'll do 5. And I'm going to put on the maximum intensity projection, or MIP tool. And as I scroll, you'll see that it makes things stand out a little bit more in this particular case. And I actually think that they've got calcifications up. The upper ones are in the ophthalmic portion of the carotid, and these are in the cavernous, because you remember it makes a big loop there. Next time when I show you a patient that has more prominent calcifications, I'll actually get a diagram of the carotid artery out to show you its pathway in this particular region. So I'm going to scroll some more. I still see the calcifications, and you can see they're a little bit more curvilinear here. So that's how you discover it. You can see it in the sagittal view for sure. You can confirm it in a different view. This patient, unfortunately, we didn't get down to the bifurcation of the carotid in the C3, C4 region, but I would almost guarantee that they would have calcifications in this cervical portion of the carotid artery as well. We just didn't get down that far with the volume. I don't take the volumes, I just get them sent to me. So hopefully that's helpful. You can see why we look there. You can see how they're subtle sometimes, but this patient should be referred to their primary care provider for evaluation of hypertension and stroke risk, as well as possible undiagnosed type 2 diabetes mellitus. Hypertension, cardiovascular disease, kidney disease, and diabetes, they all are comorbid. So watch for them, look for them, and hopefully the materials I post will help you find them. Thanks again.